Hi, Mariah.
Hi, Rebecca.
Long time no see.
Yeah. I had a presentation.
I have to say, you were one of the first people to say you need to situate bridging factors in the children's mental health context more. I listened to you, so you can tell me if I'm on the right track or not.
That's so awesome. That's why I'm here. Was just see how you followed up on that.
Yeah. Hi, Kelsey, fellow bridging factors.
I know, I'm so excited for this.
Oh my gosh, that background. You're just like rubbing it in.
Sorry.
That is rude.
This is affectionately called the Turtle Pond at San Diego State. It's one of my favorite places on campus.
Oh my gosh.
Is it, I mean, like, are there really turtles?
Mm-hmm. I probably shouldn't have said that. I'm sorry. It's terrible.
Just, like,
it smells
even better.
It's foggy. Like it's not wonderful at all.
Greetings to everyone who's joining. We're just going to give it a couple minutes and then we'll kick off here.
Oh, yay. Kitty View from Cali.
Stumbles is here to cheer on your presentation. Gandalf is also here. They're hanging out.
Aww.
Welcome everyone. I'm just going to give it a couple more minutes as folks join. Rebecca, I didn't ask you this. Would you like to take questions kind of throughout, or do you want folks to wait till the end? Is that better?
I'm fine with people jumping in. I can't see the chat, so just let me know if something comes up.
Okay. Great. Well, I think we'll kick off if you're all set, Rebecca. We'll let folks join as they can. Welcome to everyone who has joined already. My name is Byron Powell. I'm co-director of the Center for Mental Health Services Research at the Brown School. And it's our pleasure today to have Dr. Lengnick-Hall join us for the seminar. Dr. Lengnick-Hall is currently a second-year postdoctoral fellow in the NIMH-funded T32 program at the Brown School. And she received her PhD from the University of Southern California, where her dissertation was funded through a 2-year F31 fellowship through the National Institute of Mental Health. And she's currently a fellow through the National Institute of Mental Health funded Implementation Research Institute. And she's doing really amazing work related to bridging factors, which she's going to tell us more about. And so I will turn it over to you without further ado, Rebecca, and folks who are on, feel free to ask questions in the chat throughout. Thank you so much for joining, and we should have plenty of time for discussion and Q&A at the end, but feel free to raise sort of timely or clarifying questions throughout in the chat if you like.
Sounds good. Let me share my screen. All right. Byron, you can admit the people while I do this, right?
Yes, we'll do.
Okay, got it. All right, everyone can see my screen, okay? Okay. So thank you all so much for coming today. I'm gonna just dive right in because I have a lot that I want to share with you. And I wanted to start by saying that I presented a portion of this presentation a couple of weeks ago to a DSW group. And at the end of the presentation, when I was taking questions, one of the students leaned forward and said, I have to tell you, Rebecca, listening to your talk just made my blood boil. And I was like, oh, okay. First of all, I didn't even know it was that interesting. But second of all, let's talk about that. And he said, look, in my state, we are restructuring child welfare once again. I had to lay off 5 of my staff last week, and we are just struggling to keep the lights on. How does all of this implementation science stuff help me? Like, how can I make this useful? And so I just wanted to start by acknowledging that this gap between the science of implementation and building the science and what it feels like to actually implement, it can feel too big sometimes. And the science part can feel too slow. And while I didn't have solutions for keeping his lights on and keeping his staff, I do think that one thing that I strive for as a researcher is to constantly think about how would I explain my research to someone like him. And so if you came to my presentation last year, I had this guy help me out. And I like to keep it fresh. So I have someone new this year that I'm going to turn to a couple of times during my presentation. Of course, lovely Michelle Obama, who I love even more than Jeff Goldblum. But she's going to represent agency leaders like that DSW student who is just struggling to implement and might feel disconnected from the research side of things. So that being said, I'm going to dive into one of our favorite implementation frameworks, and that is the EPIS framework. EPIS stands for Exploration, Preparation, Implementation, and Sustainment. And in 2019, some of my colleagues, including Kelsey, who's on the call today, did this really great systematic review of the EPIS framework. So they looked at, okay, let's take stock of the literature. Let's see how this framework has been used. Where has it been used, both in terms of country and context, around what interventions, and they used what they learned from the systematic review to make some updates to the EPIS framework. And one of the things that they did was draw attention to this idea of bridging factors. So bridging factors, as defined in that 2019 systematic review, are factors that cross or link the outer system and inner organizational context. So, Anola, do you read me?
Yes, I had to unmute.
Tell me an organization that is on your mind, right? Ooh, whoa. Tell me an organization that is piquing your interest right now in the implementation science space.
Okay, I would say the St. Louis County Public Health Department seeking to administer COVID vaccines.
Okay. So typically in implementation science, if that was the inner context that we were working with, we would likely look at the leadership, the culture, the climate, the attitudes of those providers who are expected to deliver the COVID vaccine. So who might be in the outer context with this example that you just gave me?
Well, I think community stakeholders, advocates, funders, suppliers.
Perfect.
To name a few.
That's all I need. Thank you. So in implementation science, we often look at the inner and outer context separately. So we acknowledge that they're both there, but what bridging factors does is really start to look at, okay, how are these funders, these suppliers, these outer context actors influencing what's happening in Anola's example, being the Department of Health that's giving out these vaccines. And so I'll get into this a lot more, but this is what we're thinking about with this bridging factors idea. And we don't think that it has to be EPIS only. We might see bridging factors in the CFR framework around here, so that boundary of the inner and outer setting where they're hitting up against each other. We might see it in the health equity implementation framework around here. So places where the inner organizational level or local level are coming up against those more, those broader environmental things like physical structures, societal influences, etc. Okay, so I know I'm getting into the weeds with conceptual frameworks. So if I were trying to explain it to that practitioner, to wonderful Michelle Obama, I would say, okay, what does it really take for your organization to implement and sustain an evidence-based practice? So again, a lot of times in implementation science, if we're doing organizational research, we will look at those inner context features. So things like climate, culture, leadership. And while they are very important, I think a lot of the things that we see inside the organization are very much affected by the environment within which the organization is situated. So all of my social work buds out there, we are trained to think about person in the environment. And that is totally how I think about organizational research. It's looking at the organization in the environment. So who might an organization like this Mrs. Obama's clinic be connected to? So it might be connected to other organizations that are implementing the same EBP. It might be influenced by state or county level systems, so like a child welfare system or a county level Department of Mental Health. There might be other external funders, so maybe there was a foundation in the community who cares about a particular client group and said, okay, we'll kick in some funds for initial training. The clinic might be connected to an academic institution like WashU. And we also know that the policymakers really matter. They might be the ones who are saying, okay, here's the list of EBPs you can choose from, and this is how much money you get to do it. We also know that clinics can be really creative in terms of making services accessible and where they deliver services. So perhaps this clinic is offering the evidence-based practice at a local church. And lastly, clinics could be connected to the developer of the evidence-based practice. And this, I think a lot of times we kind of forget about the developer. We think they're important on the front end, but they can be really important for monitoring adaptation, for example, over the course of implementation. So for me, bridging factors are these yellow lines. They are the connective tissue that binds an organization to all of the entities in the broader environment. And so what I love about bridging factors is that even if we want to look at an organization, it forces us to step back and look at the big picture. So in a paper that came out last year, we tried to make this definition of bridging factors a little more specific. So we proposed that they could be relational ties, formal arrangements, or processes. So let's make it real with an example again. So let's say Michelle's clinic is connected to an academic institution, a policymaker, another organization implementing the EBP, and an external funder through a community academic partnership. We might think about this as a relational tie type of bridging factor. Or maybe she's connected to a policymaker who is funding a state level service system and other organizations through a contract that supports EBP use. And we might think about that as a formal arrangement type bridging factor. And lastly, maybe all of these organizations are feeding information back to state or county health departments funded by the CDC through a data sharing agreement. That could be an example of a process type bridging factor. So again, when I think about all of this, it gets complicated really fast, but I remind myself that whatever complexity I'm dealing with as a researcher is less than the complexity that practitioners face when they're trying to do all these things. So I hope that one of the things that Bridging Factors does is just mirror that complexity a little bit more. Okay, so you might be thinking, I'm not sure, I've seen things written about partnerships, contracting, system coordination, interagency collaboration, etc. What's actually new here? And I always appreciate that question. It's something I ask myself a lot with this. So let's turn back to Michelle, and let's say I'm working with her on a project and she's telling me, and I'm sure you've heard this either in your own practice experiences or your own projects, but she's saying, look, my clinicians are really burned out trying to implement this evidence-based practice, and I just don't know if we can keep doing it at our agency. So how might we look at this experience through a bridging factors lens? So first of all, we have to identify the inner and outer context. So her clinic would be the inner context in this example. They're the ones delivering the evidence-based practice. The outer context could be a state-level Department of Mental Health. They're the ones paying for the evidence-based practice. And let's think about a contracting arrangement as a bridging factor. So what would make this contract a bridging factor? First of all, it's connecting the outer and inner context. Next, we consider bidirectional influence. And I think this is where it starts to get into what value added, what bridging factors are adding value to in the existing literature. So rather than just looking at, okay, the Department of Mental Health is telling this organization to do X, Y, Z, we really think about how is the organization reacting? They're not passive. They're not just absorbing all of this. They could be pushing back and negotiating. They could be making adaptations. So it's really that bidirectional influence that makes a bridging factor a bridging factor. And the second way that I think it pushes the literature forward is that we dig really deep with the specific ways that, in this example, the contract helps or hurts implementation from both the outer and inner perspective. So I will make that more clear in just a bit. So let's think about, again, this issue of clinician burnout, not knowing if you can keep going with implementation. What questions might I ask if I was thinking about bridging factors and particularly this contract? So I would ask, how much does a billable hour cover? Does the contract say anything about training? What about coaching, supervision, or fidelity monitoring? These are all things that we as researchers say are really important for implementation and sustainment. Does the contract specify who gets the intervention, and do those eligibility requirements actually match what the intervention is designed to do? What about referrals? And bigger picture, how many years is the contract? Is this like a one-year thing and the organization already has to worry about where they're going to get funding again? And is the contract stable? And this is where we have to step back and look at the broader political and legislative environment. And again, it's not just looking at the contract from the perspective of the state mental health department, but really looking at it from the organizational perspective too. So how are they dealing with these details of the contracting arrangement? So this is Byron. This one's for you. So I've been interested in bridging factors for a bit, and I started talking about them pretty much as soon as I got to WashU. And Byron, being the good mentor that he is, has pushed back along the way, and his skepticism and questions made me realize that I needed to dig deeper with the conceptual work before I could start writing the aims that I wanted to write. So in response, I started thinking about what do I need to do first to advance this construct. And for me, the most pressing issue was how do we actually measure a bridging factor? So I kind of thought about the reporting guidelines for implementation strategies that Byron and Enola and colleagues wrote, where you break down a strategy in terms of dose and actor and action. Like, how could we do that with bridging factors? And so I started talking about this at the D&I boot camp last year. And by the end of the boot camp, I had this handwritten list of potential dimensions, and Greg suggested, okay, let's bring in the co-authors from that original systematic review. And I got to meet these wonderful women, and I already knew Greg, and we started thinking about, okay, what are the next steps? And we decided that we wanted to write a manuscript that did three things. First of all, raise awareness about bridging factors. Second of all, make it really concrete with case studies. And third, lay out a research agenda for the implementation field. So to do that, we first had to really get into the existing literature. In implementation science, a lot of times we are recycling old ideas and applying them creatively to implementation. And so, this idea that organizations are connected to their environment is not new. And so we wanted to look at, okay, where might bridging factors be showing up in existing implementation frameworks? Or how is this inner and outer context boundary getting blurred in the implementation strategy literature? Organizational theory already has constructs like bridging organizations and bridging tactics. And of course, there's the social network literature that has things like brokers, bridges, boundary spanners. So we started meeting as a group, digging into the literature and writing and reading and just figuring out, okay, what is different about bridging factors and how is it actually adding something? So then, because this is a relatively new construct for implementation, we couldn't search the literature using that term. And so we had to draw upon our own research experiences and then seek out other examples. So again, looking at the 3 buckets we outlined in the previous paper, the relational tie bridging factors, formal arrangements, and processes. And so we got cases and purposely tried to get, to the degree that it was feasible for this project, some diversity across intervention, context, and these 3 bridging factor types. So I'm first going to tell you about the relational tie examples, and I'd love to hear if any of this resonates with you all. So one example we had was a partnership between a local government in an LMIC setting and churches. So the inner setting was churches and the outer setting was a local government, and the interventions were related to HIV services. I saw Alicia jumped on. So Alicia, this is your example. We had a partnership between a public sector child welfare system and local substance use treatment providers. Kelsey's example is on here, interagency collaboration among a state and local organizations implementing interventions related to autism spectrum disorder. This is one of my favorites because it was actually an example of a failed partnership. So a broken bridge, if you will, and how that broken bridging factor actually negatively affected implementation and sustainment. And this last one came about because as our work group was meeting and we were developing this work, I was able to present this stuff in different venues. And I did a presentation for the VA in Arkansas. And at the end of the presentation, I always ask, what am I missing? And people felt very strongly about thinking about an individual person as a bridging factor. And I was resistant to that at first because I thought it was getting too close to social network literature. But I brought it back to the work group and we decided to go ahead and pursue a case study that showed how a person could be a bridging factor. So we have one example of an individual connecting a medical center with a state-run prison around programming for incarcerated pregnant and postpartum women. So this gives you an idea of kind of the diversity of cases that we got. For the formal arrangements, we had contracts, we had a policy-driven fiscal incentive, and then Nicole did a really awesome job of laying out how earmarked taxes could be viewed as a bridging factor in relation to implementing EBPs for mental health. This last bucket is my favorite and the hardest one to find examples, I think. So one example was a data sharing process that connected local and state health departments with other organizations implementing HIV services, so primary care clinics, AIDS service organizations. And then we also had an example of accreditation. So one actor in the outer context that we sometimes forget about are program developers. So this example shows how an accreditation process connected program developers with organizations in the context of a EBP for child welfare. And we fully acknowledge that there are likely other buckets and other examples, and we hope that this work just really starts a conversation and gives people enough to work with in terms of applying these ideas to their own work. So for each case, we went real in depth with it. We started with, okay, what's the outer and inner context? What kind of capital is being exchanged in relation to EBP implementation? So not just money, but knowledge, training capacity, connections with the developer. How is this impacting the inner and outer context? We wanted to learn more about the origin. So is it a planned implementation strategy? Is it something that's mandated by the state, or is it just a voluntary thing? we wanted to capture if the bridging factor changes over time. Is it short term? Do you have to modify it over the course of implementation? And then we really wanted to try to grasp the scope. So some bridging factors might be really specific to a particular intervention or context, and others could be generalizable across systems and interventions. And so this list that I'm showing you here is our final version. It did not start out like this. The way that we did it is every time we got a new case, we would look at the case, compare it to our other cases, and refine and reorganize these list of dimensions. Here's a list of all of the people who contributed case study knowledge to us. So we definitely couldn't have done this work without them. So this paper is currently under review at Implementation Science. So knock on wood, hopefully it'll be available soon. And the feedback we got, honestly, was exactly what we needed. This is kind of one of those papers where you get in your own head and you need someone to tell you what the places that are not clear enough. All right, so as I mentioned earlier, a third thing we wanted to do was like lay out a research agenda for the field. And so just going through these case studies, just the process of collecting them and analyzing them started to show us the ways in which bridging factors research can be really hard. First of all, some of these dimensions are hard to identify. So knowing if something is a planned implementation strategy is pretty easy. But really getting at the capital exchange or the impact that it has on the inner and outer context, that can be tricky and it's not always obvious. And to that point, you need in-depth system knowledge, and some of this information may be sensitive or of a political nature, especially if a bridging factor is not supporting implementation. We also found that in some cases, the inner and outer boundary was hard to nail down. All of us know that implementation contexts are very nested. So clinics nested in, agencies nested in counties, states, blah, blah, blah. So you can move that inner and outer line in a lot of different ways. And I think that's going to be a challenge, but also an opportunity for this kind of work. Of course, operationalization is still in its infancy. So again, we're just starting to make it concrete. And where I really want to focus on next is we think there's lots of space to develop methods for empirically testing and demonstrating relationships between bridging factors and outcomes. So the practitioners that I'm really focusing on now in my current work are agency leaders in the New York State Children's Mental Health System. Through a fellowship with IRI and the IDEA Center, I've gotten the opportunity to get connected with Drs. Kimberly Hogewood, Mary McKay, and Andy Cleek. And so here, what I'm trying to do is apply what I've done with bridging factors, but figure out how to actually test it in this New York Children's Mental Health System. So the questions that we've been grappling with, they probably seem pretty basic, but each one has been like many conversations. So what are the inner and outer contexts? What bridging factors are most relevant to start with? What kind of data do I need? And how do all these ideas actually fit within the history of children's mental health research? So one of the things I love about implementation science is that a lot of what we do, we can transport across contexts. But every time we're in a new context, we kind of have to learn the history and the rules and kind of the constraints of whatever we're bringing. So that's been a really big learning opportunity for me. So the inner context that I'm thinking about in this work are Office of Mental Health funded agencies, and there are a bunch of clinics, hundreds of clinics nested within them. And the two outer context actors that I'm thinking about are payers and then the New York State Office of Mental Health. The two bridging factors that my mentors and I have decided to start with are contracting arrangements and this center, which provides training. So this center links the Office of Mental Health and the agencies providing evidence-based practices and helps them with training and support as they are implementing. And again, you're probably sick of me saying this, but all of these decisions required really deep system knowledge. In terms of figuring out what data I needed, I am using this rough conceptual model that I developed. It's based off an adaptation of the health services utilization model, and it basically gave me categories of data that I needed to track down. So things like agency characteristics. So how big are they? How are they funded? Workforce demographics. And I worked closely with Andy to figure out, okay, what data are already being collected by the system and what things will I need to collect new? For child level factors, we're thinking about the typical demographics, age, gender, race, ethnicity, family risk factors, severity of mental health status, insurance status, and geographic location. In terms of access to EBTs, we're looking at the agency level, what EBTs are they providing, to whom, and other access issues like, can you do same day appointments? Is there access to psychiatry? For child level EBT use and engagement, this is where Dr. McKay is really contributing all of her ideas on this. And so looking at dropout, no-shows, modal, and average number of visits. And then, of course, my favorite part is the bridging factors. And so some of these bridging factor details I can get through a quantitative survey, but I have to have some qualitative parts too. So I'm going to have to do some in-depth interviews and also some creative document hunting in terms of getting contracts, looking at published websites. Yeah, so that is going to be a very mixed methods part of all of this. Some of the things that I've been thinking about in terms of how bridging factors fit within the history of children's mental health are the policy context, so Children's Mental Health Initiative, the system of care approach. The idea of interagency collaboration and coordination has been talked about for decades in this field. And so one thing that I'm really looking at is how could bridging factors enhance the measurement of interorganizational relationships in this space? I'm also looking at what outcomes have or have not been tested, especially when we think about that connection between implementation, client, and service outcomes. And one of two of the guideposts that Dr. Hoagwood gave me as we were making decisions about which bridging factors to focus on, and I just think this is something I'm going to take with me for the rest of my career, but she said, what is malleable and what is generalizable? And this question really gets at the heart of why I even want to do this work. My vision for bridging factors research is that this kind of research and nailing down these details and these interactions and these inner and outer context connections will help us understand how to design and create and evaluate implementation strategies that span the outer and inner context. So examples of strategies in the ERIC compilation that do cross this inner and outer boundary are things like accessing new funding, incentive structures, data warehousing, record systems. How do you provide ongoing consultation and training? We know, funding runs out. How does a department and an organization make that work over time? So I do hope that bridging factors research can really get at some of these implementation strategies that are less researched in the field right now. And ultimately, I can't promise that I could ever help a clinician keep their lights on or not lay off staff, but I do think well-structured implementation strategies that really take into account these inner and outer context relations can set organizations up better to be successful with implementation and sustainment. So that is all I have for you. I'm hoping that we can get at, I love your feedback and questions. I'm gonna get out of this so I can see your faces, hopefully. All right, so happy to get reactions. Yeah.
Please, folks, feel free to speak up, or of course you can put questions in the chat if you're shy, but feel free to just speak up and ask questions. Thank you for that, Rebecca. That was terrific.
Sure.
It was great, Rebecca. So I'm gonna ask a question since I inspired this project. And I worry that the entire D&I community is going to gasp at this question because I don't know anything about this area of science, as you know.
Bring it on.
But as I was looking at your model, and the outcome is, the child access to and engagement in EBT. Do like the mental health outcomes for the kids, do those factor into the model? And I guess I'm thinking like, it looks like you're wanting to measure, okay, are the EBTs getting to the kids?
Mm-hmm.
That's the main measure of concern. And I'm wondering, like, where and again, I'm sorry, I feel like I'm asking a really stupid question.
Oh
but
my gosh, no, I think I know where you're going. And like, so
yeah, I just wonder if like, so the EBTs there are the kids having better mental health outcomes as a result?
Yes. That is not a stupid question. And
Okay,
you are representing that reviewer. You're representing that reviewer of my K who is like, okay, how is this actually changing functioning and psychological outcomes? And first of all, it's a data issue. I've talked with my mentors a lot about the availability of that data within the scope of this project. And I think a lot of implementation research makes that assumption that if the services are there and we know they're good quality, that they will produce good outcomes in terms of, child functioning. So it's kind of like a part of the model that I can't address in this particular project, but that is my ultimate dream, to take it to that place. Okay, so we have access, we have use and engagement, and then is it actually changing, moving the needle on outcomes? So I'm thinking about it. I didn't include it. It would be like little dashed boxes on the right, I think, but I just can't get to it yet in this project, but that would definitely be a goal for sure. So thank you. I appreciate that.
Well, and I think our original conversation about this was just from my experience working in children's mental health, and my experience with, like, I think for some providers too, it's kind of like there's this maybe sort of a certain amount of skepticism about the value of EBT.
Yeah.
And then I think, sort of part of the selling point is, well, so there's greater engagement with EBT, and look,
right,
children are getting better too.
yes, and that, that is getting at the heart and value of implementation science. I think Enola actually said this in our class yesterday. If it doesn't matter for achieving implementation outcomes, like who cares if you are achieving high fidelity to an intervention if it's not actually making clients better? So I think connecting.
Yeah, I mean, I think for those of us who study it, we're like, it's sort of a given that we know that people improve. But I do think because of this disconnect between the academy and services, that there is this persistent skepticism of EBT. Yeah. I mean, I even hear it in some of our MSW classes where students are skeptical of why they should have to learn EBT. But I think like when you can see, actually, it does work. It is improving our numbers and making our work easier. So.
Yeah, no, I hear you. And, Enola's original and colleagues' original conceptualization of implementation outcomes, that we have implementation outcomes, we have service outcomes, and we have client outcomes, and understanding the relationships and do these outcomes affect each other? I mean, that's just a big question that our field is working on, and we can, NIH reminds us of the importance of that all the time too. So thank you. I do appreciate that, and I'm definitely thinking about it.
So Rebecca, this is Leo. This is a great presentation. I joined in a little late, but this is wonderful, and it's awesome to see how you have and your team has continued to build on this. I have two questions, that one comes to mind as you're talking about contracting incorporation, and one of the issues here that nobody talks about actually is fraud. Like when there's a fraudulent contracting element, and I was just there's a case today in the news about people jumping the line in vaccine, and it's a company who has a contract with the state of New York, and how they might have been engaging in fraud, and part of it is the contracting element and who the regulatory and legal aspects of that. I think is really important, which you have. So who's accountable if the contract gets broken? What happens? Who's actually tracking that these contracts are being followed in the way that they need to be followed to deliver the care that they need to do. So that's one aspect of how you bring that into the work that you're doing. And these bridging factors are one place where regulations, accountability becomes really important. And then what is the consequences that may happen?
The enforcement.
The enforcement of that, that's right. The other piece here is thinking sort of from my health equity, health disparities hat, is that the bridging factors are our structures. This is where we can realign services and contracts to, for example, a lot of these contracts to reduce cost, to increase the number of units of services. But what about reducing disparities or inequities? Examples are on bridging factors that have an equity component to them as we're thinking through, particularly in the children's mental health services, like access to EBP, but access to EBP for whom, where.
Right.
That is, I think those are really important. And this is an area where it's a big leverage. Like if this is done correctly, I can see how you can realign a service system to address some of these things. So it was really exciting to see.
Yeah, it gets at that malleable part. And I'm thank you so much for bringing that up, because in that DSW class that I presented to, another student asked me where I thought implementation science was falling short. And I did bring up this equity issue, and he was coming from the background of, he works in tribal communities in Oklahoma. He happened to be implementing SafeCare, which was the EBP that I looked at in my dissertation. And he's like, how can we consider the colonial context of EBP implementation? And so I think it's not just the way that the EBPs are structured, but how we bring evidence-based interventions to different communities, and who has a voice, and like which ones are even considered and things like that. So thanks for bringing that up.
And I think of New York. New York is a great state that has challenges. There's all these contracts and when you think about the history of New York State mental health system, as these reforms get out there, they benefit certain organizations that have a better infrastructure versus other ones that don't. And sometimes those are the ones that are delivering care to the most at need and the most vulnerable and marginalized population. And the contracts don't address issues of infrastructure, training, and everything that needs to be included.
100%. In our accreditation example, the program developers were requiring agencies to pay a $1,000 fee. And some of the providers were like, $1,000 might not seem that much to other organizations, but we're like a small little nonprofit, and that actually really hurts us financially. And so that's a great point, kind of inequity at the organizational level too.
Rebecca, I just wanted to say, oh, sorry, go ahead, Byron.
No, after you.
First off, fantastic presentation. Your work is always so fascinating and relevant. I love that you're highlighting how intermediaries exist across framework. You know, Ethics does such a good job calling them out specifically, but they are a real part of policy and practice. And so they're not just a theoretical construct. So it's nice to see different ways to identify them in CFR and other models. I have a question about intermediaries, which is a part of my work as well. So I love that I can talk to somebody else about this. Are you looking at any of the competing motivations for the relational tie bridging factors as another sort of component or dimension in the outer context? So just to sort of operationalize that out of jargon, right? Like I'm thinking about, in my research, I see state Medicaid agencies working with, they hire consultants or they have NGOs that serve as these relational tie intermediaries that help them vet evidence and think about different EBPs they want to add into the benefit. And so I'm wondering if you're doing anything to look at, well, what are the competing motivations of those intermediaries that get in the position of being a relational tie? And how do their desires and their sort of political agendas or advocacy agendas play a role on the inner context and their ultimate actions adopting practice?
Oh my gosh, that is such a good question. And thank you so much for coming. And I think you're better at answering Leo's fraud question than I am. Gosh, you know, I feel like we got at that indirectly with the way that we were going about this. So when we looked at the impact of bridging factors on inner and outer, that's where we kind of saw the results of these different interests. So like sometimes something would be more beneficial to the outer context than the inner context. But I think what you are bringing up is a really important a thing that should be more explicit and not just looked at after the fact. So I just made a little note for that. And I'm going to go back and look at our dimensions and see if it could be folded into one that we already have, or if it needs to be, I almost feel like it could maybe go in the origins category. Kelsey, I don't know if you have any thoughts, fellow Bridging Factors work group member. But yeah, that's a really, thank you for that. I'm going to think on that.
Yeah, no, and I think you started to address it before, so maybe it does fold in this idea that, you know, policy D&I work is starting to pay attention to the politics of implementation, right? Because we sort of like, we're like, oh, that's outer context, it's sort of there, but we don't really focus on it. And people like Jonathan Pirtle are starting to be like, no, policy, partisanship, they matter so much, let's dig in. And I feel like that's sort of, you talked about that with your thinking about like the stability of the political context. And so I think also thinking about like the agendas of those relational intermediaries would be really cool.
Yes, I love that. Thank you. I'll follow up with you about where we could put that in.
Callie, you had a great question in the chat if you want to raise that, if you're able.
Sure. And I'm going to steal a line from Molly and say that this is coming out like semi-baked from my mental oven. It's not all the way there. But we usually think about the inner setting as the place where the EBP is actually being delivered. But I'm thinking for something that is a mandated policy or program, there might be like characteristics that makes a mandating entity kind of like an inner setting. So for example, if I'm a state health department and I am mandating to my local health departments that, okay, you're gonna do routine cancer screening with, you know, this certain eligible population. I, as a state health department, and I'm interested in outcomes like adoption. So how many of my local health departments actually picked up the screening program, compliance. So how many are doing it the way they're supposed to be doing it, enforcement, like what can I do as someone who's telling you to do this program to make sure that you're actually doing it the way it intended? And then for the local aspect, they're very much interested in, okay, how many clients am I reaching with this? Are our providers doing this screening with fidelity? Is this acceptable for my providers? How is there benefit in like, how do you conceptualize looking at bridging factors from like multiple actors within this kind of system of relationships?
So you're kind of saying there would be two inner and outer boundaries that we'd be juggling at the same time here.
That's what I'm wondering. Like, would you conceptualize something like that? Or like, what does that look like?
Yeah. You know, as we were working on this manuscript, Greg wanted to have lots of layers at the same time too. He was like, well, there are multiple layers to the inner context and outer context. So I think we can get, I made this picture for Mary and Kimberly of like a layer cake, and like we could get at all the layers and take a slice of it at one time. Like maybe that's the direction we're going. I think for now, and maybe this is being a slow scientist, but I think maybe the next best step for modifying and enhancing our existing frameworks would be probably to start with maybe just one inner and outer context like relationship and make sure that we can measure that and understand that. But yeah, I mean, I like complexity, so maybe having two boundary lines at the same time, I think could be really interesting. And yeah, that could maybe be like the next steps in measurement. I like that. Thank you.
I like how you're thinking.
I mean, I just like cake anyway, but I picture a slice of these levels at the same time. That's kind of how I think about it.
Rebecca, when you were kind of coming, I don't have the slide with all the examples and that you had from different projects. Did you have any international examples or examples?
We had one. Cool. Yeah, we had one. Nicole had this really cool, the intervention was Healthy Beginnings, which was engaging, it was HIV services engaging mothers in early care. Kelsey, I can't remember, do you remember which country? I don't want to misspeak.
I'm pretty sure it was Kenya, but don't quote me because my mental oven it's in service right now.
Your mental oven is still preheating.
Yeah, that's what it's doing.
Yes. So Byron, or anyone, we have, so in our manuscript, we have a summary table and then we have detailed write-ups of each case. So if any of those cases piqued your interest, I'm happy to just send you the full write-up.
I guess I was just thinking like our healthcare system compared to universal healthcare or things like, like yes. part of what makes this interesting is like how much variation there is in the outer context in certain spots. And so I wondered, I'm sure there's, similar variation internationally, but at the same time, there's maybe more standardization in terms of how healthcare is or whatever.
Yeah, and that gets to that point that Kimberly Hogo had asked me when we were thinking about this, is like, what's malleable? What's malleable might really change depending on what country you're in too. So yeah, I appreciate that point.
To this discussion, one thing that came up when we were writing this is this idea of, we wanted to define the inner and outer context, but that was actually much harder than you thought, because that was malleable depending upon, even at what stage of implementation you're talking about, right? And that sometimes those lines were really, really hard to draw in terms, but we wanted to try to draw them to make very clear case studies. But yeah, that's just so hard. And it is really complex and changes.
And I'm slightly embarrassed to ask this question, and you touched on it, Rebecca, so sorry if I missed this, but like, it seemed like on one slide you were saying this is moving towards sort of like these are targets for implementation strategies. And then at some point I was wondering, like, why are we calling these factors like they're sort of determinants rather than more active strategies? And I promise I'm not trying to make everything an implementation.
No, stop pushing strategies on me. Right. So actually in our paper, this is dedicated to Byron Powell, we actually we talk about when a bridging factor might be a determinant or a contextual feature and when it might be a planned strategy. And we use community academic partnerships and show how it could be both of those things. So I think they can be both, which I know is an annoying researcher answer, but yeah, we spend a lot of time thinking, and it goes back to the point of like, okay, are bridging factors different than implementation strategies, and what's the point of adding this new construct? And so, yeah.
Actually, I would chime in there. I would turn that into an empirical question. If you compare different bridging factors, what the impact that they might have, and if there's any natural experiments happening in our mental health field where there's different bridging factors happening here in some states or so, in some type of reform or things like that. Because for Byron, everything is implementation strategies, but it's important to sort of figure out what that is, and I think it's a great question actually to understand.
Yeah, and natural experiments and also simulation models are something that I'm thinking about in terms of seeing, do certain bridging factors or combination of bridging factors lead to outcomes in different ways. So. Oh my gosh, Chris, what is happening over there? Keep the video on, keep it rolling.
Please keep having an educated discussion. Don't look at what's happening.
You guys know I'm a cat person. We still have a little time if anyone has. I see some students from our implementation strategies class and my T32 buddies happy to take. If any of this stuff was too implementation sciencey, happy to bring it back down if that's helpful. Bye, Kelsey. Thanks for coming.
I have one more question. Sorry, that's, I don't know if this, how answerable this is, but like how much of the study of bridging factors is going to be impacted by the maturity of our understanding at the organizational level, and more so I'm thinking at the policy level. So I guess I'm wondering, I know I think Erica was the one that mentioned, Jonathan Pirtle's research and other folks that are focusing a lot on policy within implementation science. But I guess I'm wondering, like, can you characterize sort of where we are in both of those domains, and how much progress related to bridging factors will depend on, what we actually know about how policies influence implementation? And
what were the two domains, policy and what?
I guess I'm just thinking like policy, financing, the outer setting stuff. How much do we like is our, my sense is that the organizational stuff is a bit further along. On the other hand, I know there's this rich sort of public policy implementation literature as well that maybe we don't utilize well. And so I don't know exactly the question, but I guess I'm just wondering.
No, I think I hear you. And Erica, I want you to help me answer this because this is your space too. I think there's enough out there. I think the organizational stuff has gotten more attention among implementation researchers, and it's easier in a lot of ways. I mean, not that organizational research is just like a piece of cake, but getting into contracting and financing and policy and system level things is just it can be harder in some ways to collect data and build that into a study. I do think the fact that implementation science is becoming more diverse in terms of disciplines means that we're getting more people who are trained in how to do that and know how to get those data. So I personally think it's more just a matter of what has gotten attention so far, not what is possible. But Erica, I actually really want to know your answer to this.
Oh gosh. Well, I think you gave a great response. I do think that policy D&I work has been historically understudied, but there's a lot of momentum to start looking at this work. I mean, there are several federal policies right now that are sort of focusing on how do we improve the uptake of evidence-based practices. To the extent that we can see how those federal initiatives translate into actual community health clinics, adopting those evidence-based practices, that's harder, right? I mean, aligning those sort of like policy systems and organizational levels all in one study it's hard work. But there's some promising work out there that is looking at that. I know Greg Ahrens is leading his LOCI work, really tries to do that at the systems and policy level. I think the hard part about that is just the opportunity, right? So let's say you are fortunate enough to really understand those bidirectional influences from the inner and outer context on policy implementation or evidence dissemination across policy. Where do you find the opportunities to actually start testing those dissemination or policy implementation strategies, right? That requires some really close work with state or federal agencies, and we traditionally haven't engaged them well in research. They typically look to consultants. So I think there's some opportunity to not only use policy D&I, but also some community engaged research approaches to start working with those stakeholders a little bit better and get some really rigorous test of policy dissemination and implementation strategies going.
Your answer was better. Thank you.
No.
You both had wonderful answers.
I knew it.
No, I learned so much from you all the time, Rebecca.
Looks like we have or Byron, go ahead.
No, I was just going to say we're almost out of time. So I was just going to say thank you so much to Rebecca for the presentation and for all of you for engaging and for your thoughtful questions. And I was going to highlight that Leo has here in the chat our next CMHSR seminar where we'll have Dr. Park present his work. And so very much looking forward to that, and would love for you all to join.
Thank you all so much for giving me another Zoom hour at like 4 p.m. I appreciate it.
Take care, everyone. Thank you.
Take care. Thank you, everyone. Good work, Byron.
Good work, Leo.
Thank you for hosting, man. That was helpful. Rebecca, great work today. That you've taken that whole presentation to a whole new level.
We remember to record. We'll see if we remember how to actually access the recording.
Where it actually goes.
It'll go somewhere. You have to transform. It takes a while. It's a process, man.
It's
My
in the
computer's
cloud.
about to explode with all the video I have now. But yeah, if you have any problem, just let me know, and then we can put it. We have a box folder where you can drop it there, and then Julia will